Okay. So can you please tell me what is fine motor? If we just see a broad differentiation between the gross motor and the fine motor, we will see that in the gross motor, we are basically concentrating more on the lower limb. Definitely the gross motor, the movement of the upper limb, that is also the gross motor assessment. But usually, when we talk about the gross motor assessment, we usually do assessment from the lower limbs. And when we talk about the fine motor, we do assessment of the upper limb. So what is the difference in between that? Please do remember this fine motor assessment or this gross motor assessment that is basically present in all the small muscles and the large muscles. If you want to assess, if we talk about a very simple structure of the brain, like what is that? There is a brain cell, all right, the cell body, then there is neuron. These nerves, they are going downwards, okay? There is a neuromuscular junction, and this neuromuscular, every step, there are some points. Like here, that is the anterior motor neuron. Then after that, there is a nerve that is going, that is a peripheral nerve, it's going to the muscles. There is a neuromuscular junction. Okay. So when you want to assess the power, the coordination between the large muscles, that is your gross motor assessment. And when you want to assess the power, the coordination of the nerves and the small muscles, like your intrinsic muscles of the hand, muscles of your fingers, muscles of your toes, that would go with the fine motor assessment. Okay. So what is fine motor? Basically, sometimes, usually it's not your like viva question that is an understood thing, but I just wanted to know if you like just keep in your mind, they want me to assess the grip of the hand, the grip of the fingers, like grip of the fingers, your pencil grab, grip of the hand. What is your what is the grasp of the child? So they want to assess the small muscles of the hands or maybe of the lower limb. But for fine motor, we will keep in our mind for the time management, we'll just keep upper limb in our mind. Okay, so there must be a coordination of the VN and the small muscles. Okay, this is the check that is a strength, a checking of the strength of the small muscles of the hand, but there must be some coordination. So that is why whenever they give you command, do the more fine motor assessment, your first question, you go for introduction, introduce yourself, then you wash your hands, okay? Then what do you say? You say what the child is doing. Okay, so you want to see the role player or examiner will say like the child is sitting, the child is playing with a toy. So this is a clue. Is the child is looking at me? Is he attentive towards me? So you want to see the coordination of his vision with you, and yes, after that we will do the assessment of the muscles. There must be coordination between the vision and the small muscles to make it a proper fine motor assessment. Okay, so what is your next question? We ask, is the child wearing any spectacles, any glasses, or hearing aid? Okay, if the child wins in not intact, how can you say? Like, can he hold the finger? Can he select this crayon? No, not at all. This is a must question. Okay, this is a must question. You have to ask: is the child is having any glasses or having any hearing aid? Okay, so Dr. Narmeen, you please do tell me the questions what you will ask when you are just going to enter into the room to the examiner. And let me unmute you. Dr. Narmeen, please speak up. Okay. What questions you will ask? Unmute you, please.
Yes, ma'am.
Dr. Narmeen.
Ma'am, first we
Don't be scared,
have
Vijay.
to like
Okay.
ask. Yes.
Okay.
First we have to
Speak up.
ask like what the child is doing.
No, no. Now, just I'm making a scenario. Just the role player has gone. Now, the command of the examiner do the fine motor assessment. So, what first questions? How will you start?
Okay, so I want to know the age of the child first and then I will like
Okay, that
start
would be like
to assess.
okay. So, Dr. Narbeen, you have taken the history. Okay, you have presented it, summarized to the examiner. Now the examiner is saying, please do the fine motor assessment of this child. The child was 4 years. Now, how you will start? We just did it yesterday, a day before, I think.
Um,
So
okay.
you your hands.
First, like uh, we will start like is she is the child able to like hold the crayons or play with the
No, no.
toys?
You will wash your hands first, okay? Then
Yes.
after that, you will ask the examiner what the Ali is doing. Suppose the name was Ali. What Ali is doing? Ali is playing with the toys, okay? When I am
Yes.
entering into the room, is Ali looking at me? Okay, so you want to see his vision is intact. He is not an autistic child. Okay, so please write down these questions. That is very much. First of all, I will wash my hands. Okay, you will ask the examiner what Ali is doing. Ali is sitting in my lap. He's playing with the toy. He's sitting or he's lying down, whatever he says. Okay, so what is the next question? Is he looking at me? Okay, so not now you have to interact yourself with Ali. Hello, Ali, how are you? Can I play with you? So these are very much things that this will tell you what is the maybe some points in the cognition, maybe some point in the socialization, maybe the child is having any behavior problem. Okay, so you will start like this. Now, are you getting my point?
Yes.
I mean, okay, so now your command is do the fine motor assessment. This is just like for starting your introduction, you have to ask some questions. I also shared in the group too. Please memorize that question. You have to ask that question very much. Same is the case when you are starting your fine motor, gross motor assessment. First, you will ask the examiner. You will wash your hands, you will collect the toys, you will interact with the child, you will say what Ali is doing. Is he wearing any glasses? Is he having any hearing aid or not? Okay. So next you will move towards, you will get the toys. Okay. So if you want to assess the fine motor, you must keep in your mind three C and three B's. You should start with the C. See why that is an easy task. This one, though that is also easy, but yes, always start with the crayons. There is a crayon, there is a cube, there are the cards, board, beads, and yes, okay. So easy is and interesting. Like if you just want to ask, is the you are just giving the scissors to the adi and ask him to cut this paper? No, that would not look very nice. Start with the crayons or start with the cubes. Okay, so if I give this much crayons to the adis, or you can say, where is the red crayon? Can you please point me where is the crayon? So you want to see what is the receptive speech of the child. Is the child listening to your commands? Okay, I think where is the red crayon? Or you may open up the book. Where is what is this in this book? Maybe some paper, like any butterfly, depending upon the age of the child. Okay, so you have to assess, is the receptive speech of the child is intact or not? Is the child able to listen to my commands or not? Okay, can you please give me a red crayon? Okay, so you will give a crayon, or can you please hold the crayon? So first thing, I have given this crayon to the Ali and I will assess how the Ali is holding this crayon. How the Ali is holding this crayon, that is basically dependent what is the age of the child. Okay, and the number 2 point is that, is there any hand preference or not? Is he holding with the one hand or is he holding with the both hand? So you want to see, is there any hemiplegia, weakness of the one hand, or there is any hand preference or hand dominance that is present or not? So we will see later on what is the difference between the hand preference and the hand dominance. The first thing you will select that is the crayon, okay? And you will see how the Ali is holding the crayons, okay? See here, the first thing we will see handedness, okay? Is the child is having any hand dominance, right? Or the child is having any weakness in any hand? These 2 points, they are very important. This is the first point, that is for the assessment. Maybe this may be a case of hemiplegia. Maybe this is a case of quadriplegia. Child is unable to hold these crayons. So first thing, look for the handedness. Okay, hand dominance usually starts at 18 months mentioned. If the left-handed, that is unusual. So this is the first point. Okay, next thing, Ali, can you please hold this crayon? The next thing, that is the grip. So you will see what is the grip of the child. For the grip, I will show you. This is an excellent diagram that is for the grip. Okay, the first step. The first grip, that is the fist grip. Okay, see here, the child starts from the fingers, having all the 1, 2, 3, and 4 fingers on the palmar side. This is called fisted grip or palmar supinated grip. It starts at the age of 18 months, 15 to 18 months, right? So you can start it like this. If the child is holding the crayon in a fisted grip in a supine position, that is, what is the age of the child? That is 15 to 18 months. Okay. So if now see here, what the first thing, that was the supination, the next one, that was the pronation of the grip. So if the child is holding the crayon in a digital pronate grip, what is the more likely age? That is 2 years to 2.5 years, 2.5 years. Okay. Next one, that is the 4-finger grip or quadruped grasp. So it's easy to memorize. There is 4 finger. Yeah, this is also 4 finger. This is also 4 finger. This is also 4 finger. But see here, what is the difference in between these two? Here, the hand that is in the supination position. Here, the hand is in the pronation position. And here, that is a 4-finger grip. It's not in the palm. It's in the fingers. Okay. So when the child can hold the pen, the crayon in the fingers, okay, though there are 4 fingers, but when he can hold it with the fingers, that is 2.5 years. Okay, so to memorize the range, that is very important. 2.5 years to 3 years. Okay, so when the child can hold, like, how can we hold the finger, these pens? We hold it in the 3 fingers. Okay, so now see, just in 3 to 4 years, the child is able to hold the crayons, to hold the pencil in the 3 fingers. But that is static. He cannot write it down very properly. That is static. The grip, that is very proper, but it's in the 3 fingers, but that is a static grip. Okay. And the child is dynamic tripod grip. That is present. It's usually in 4 to 5 years. Okay. So this is the first step. Now, do remember, you will not get confused. Like, I have to select the cubes. I have to select, there was a bead, there was a book. No, not at all. Make it in a very systematic way and repeat it again and again. So first thing, I will just give him, I will ask the Ali, can you please take any color like red crayon? That would depend upon the age. Like if the child is 18 months and you are saying him, can you please take the red crayons? No, not at all. He cannot assess. He doesn't even know what is the red color. So all these would depend what is the age of the child. Can you please hold this crayon? Okay, are you give him crayon, he's holding it or not, right? So you have to see, is that the palmar grasp? Is that the pronator grasp? Okay, is that by the 4 fingers or it is by the 3 fingers? 3 fingers, 3 years, right? 3 years, 3 fingers. Do remember, when the child can hold the crayon with the 3 fingers in a tripod grip, that is 3 years of the age. 3 to 4 years, but just to memorize, 3 fingers, 3 years. Before that, 4 fingers. Okay, clear? Clear? Okay, all right. So what is, now we will see what is the hand preference of the child, how he's holding this. The next step, we will see what is the type of the grasp. Is that palmar or is that pronation? Please do remember, interact with the child very often, appreciate the child. That is very important. It will give you many clues towards the diagnosis. Okay. So next, about the crayons. First, we will see the handedness. I'm repeating again and again, like you can memorize that. Next, we will see the grip. Okay, how the child is holding the crayons. Next is for the draw. Can you please draw me? Please do remember, drawing of the child, like the child can scribble. That usually starts at the age of the 1 year. But for that, do remember, okay, this is for the cubes. Next, he is holding the crayons. We will see, can you please draw? Are you just for demonstrate? Can you draw a horizontal line? Can you draw a line? This one. Can the child make a circle? First of all, depending on, see here, if the child ages 4 years, you will see him. Can you please draw a cross? Okay. If the child ages 3 years, you will not say him, can you make a cross? Or you will not start, can you make a horizontal line? Like you will just demonstrate in front of him and you will say like this. Okay. So keep this thing in your mind. That is very important. You have to give the command according to the age of the child. The child age was 2 years and you are giving him a command, make a circle. No, not at all. Memorize it again and again. So the first thing, you will draw the line. You will say, can you please draw a line for me? Can you please make a circle for me? Can you please make a cross for me? So you will assess the age according to that. Do remember the mnemonic, that is LOX STD, LOX STD. So in the end, your horizontal line, that is by the vertical line, that is by the age of 18 months, horizontal line, that is by the 2 years. He draws a circle by the age of 3 years, cross by 4 years, square 4.5, triangle is 5 years, and diamond, that is 6 years. Okay, now this is very important. Ask him according to the age, make a man. Okay, demonstrate in front of him. He can make or not. Okay, so a 3-year-old child can make 3 things. He can make a circle, and 3 things may mean like he is just making the legs just in direct with the head. He is not making the trunk. He is not making any neck. Okay. So at the age of 3 years, he is making 3 things. One is the circle, the face, then the eyes. Okay. And he is putting the legs directly to the head, not making any neck, not making anything. 3 years, 3 things he can make. At the age of the 4 years, he is making what? He is making, there is an addition of the trunk, right? So he can make 4 things at the age of the 4 years. All right, one is the face, the next one is the eyes, then he's making the limbs, and he is making the trunk. 1, 2, 3, 4. At the age of 5 years, he's making what? He's making a proper tummy, all right? The face, eyes, upper limb, and lower limb. Okay. So after that, he even can. This is also a way of assessment of the cognition too. Yeah, that is the fine motor. That is the assessment between the child's view and coordination, but it's also a part of the cognition. You can assess the cognition of the child by this one. If the child is able to make fingers, like the 5 fingers, his age, maybe he's 7 years age, maybe he's 6 years age. So it will all depend. This is a rough estimation. You just keep these things in your mind. You just went in the room, you ask the child, hold the crayons. Next is the draw the crayon. So that draw a person test. These 2 tests, they are must. You have to do that. Okay. Next one. Okay. Now what you will do, you will keep the crayon at one side. You will not put all the toys in front of the child at the time. So first I will just taking these crayons, you will just keep the crayons in front of the table. Okay. You will not keep crayons and the cubes and all the things in front of the child. No. So I have tested the crayon. I will keep the crayon at a side. Now I will keep the cubes in front of the child. Okay. Can you please first demonstrate? Can you make, depending upon the age, like if the child age is 5 years, you will not demonstrate this one. Okay. You will ask him, can you please make steps of the bricks of the cubes? Can you please, if the child age is 3 years, can you please make a tower for me? Can you please make a bridge for me? So first you will demonstrate. You ask the child, depending upon the age. If he says no, he cannot, or examiner say no, he cannot, then you demonstrate in front of him and ask him, can you please make like this? Okay. So depending upon the age, at the age of 15 months, the child can make a tower of 3. Okay. At the age of the 18 months, tower of 4. That is very, just memorize. Cram these cubes. That is very important. Just keep in your mind, by the cubes, I will assess the age. But when you are going to describe to the examiner, you have to describe the age of my patient is this one because he can make a tower of 18 months. He can use the crayons. He can draw a man like this. Okay. So He can draw a horizontal line also. You have to describe every step of the crayons, of the cubes, of the drawing. Okay. And next one, we will give him the scissors. If now you will keep the cubes at a side. Now you will ask if it is okay. I give him a scissors and ask him to cut a paper. Can he cut a paper? If the examiner say yes, he can. So you will just keep in front of him. If he says if you will ask the examiner, should I give this to Ali or not? Okay. If he says no, yes, he can cut in a single line, in a straight line. He cannot cut into shape. So you will keep the scissors away from the child. Okay. We have done all the C's, that is with the crayons, cubes, and the cut. Okay. This table that is very easy and important. If a single cut that is present, it hold with the both hands, holds with one hand, but doesn't know how to use. So the child is between 2 and 2.5 years. Okay. All right. So this, please do remember, like this, the child can cut into shapes. That is the age of the 5 years. The child can make 4 cuts, but in a straight line. And 4.5 year child, he can cut a square. He just can cut one square. Okay. But if he can, yeah, along the square, can cut in the triangle, other shapes. So the developmental fine motor age of this child is 5 years. Okay. All right. So I have told you about the cubes. Better to memorize than from this MRCPCH clinical examination book. From that, I have taken these diagrams. Okay. Okay. Next, we will go to the board. Okay. What do you mean by board? Board are beads and the book. Now it's up to you, like you want to choose both first beads or book, but please do it again and again. Like it sits into your mind and you do not worry. You do not have to think before doing what should I choose now? Should I choose board or should I choose book? Okay. So now what are the boards or what are the books? See here, this is about the cutting of the papers. You can cut 1, 2, 3, 4 sheets. So what is the age of this child? That may be 4 years. She's having a cut of the 4 straight lines. Maybe she's 4 straight line means she can make a cross, she can cut a cross, or maybe she can cut a cube or square. Okay. Okay. So the next thing that is about the beading, please do remember, for the beads he can do the large one, that is at the age of the 4 years. 3 years. Okay. See here, for the beads, that is the large bead, it starts from the age of 3.5 years. So we will not offer the beads, we will not ask about the beads. The child age is 2.5 years. If he or she is less than 3 years, we will cut the beads from that questions. Okay. Child can make the large beads. Cabinet. That one. Okay. So large beads, they are at the age of 3.5 years. Large beads to and fro, that is at the age of 4 years. So beads, that is very easy. Like if we want to ask about the beads beading, if that is done or not, it's at the age of 3 and 4 years. Okay, so that is for the assessment for 3 and 4 years. It's easy to remember. Okay. The next about the turning of the pages of the book. The child of 1.5 year can turn the many pages at one time. And if the child age is 2 years, he's turning the pages one by one. Okay. He can color the book. It starts 3.5, 3 years. Okay. At the age of the 2 years, the child turns the book pages one by one. Right. So the next is about the board. That is very easy and that is very good too. Like if the child age is 2 years, he can make two simple shapes. He can put two simple shapes on the board. At the age of 2 years, two shapes, simple shapes. At the age of 3 years, three simple shapes. Okay. And at the age of 4 years, he can put complete simple and complex board. Okay. He can complete simple and complex board. So it's easy to memorize. 2 years, he can put two simple shapes. 3 years, he can put three simple shapes. At the age of 4 years, simple and complex shapes. I will show you on the diagram. So what are those shapes and what is that board? You see the child is having, these are the simple shapes, okay? So at the age of 2 years, he can put two shapes, two simple shapes in the board. At the age of 3 years, he can put three simple shapes on the board. But at the age of 4 years, he can put complex and simple. So this is complex. Just 1 minute. This is a simple shape and this is a complex shape. Just 1 minute, please. Okay. Hello. 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 Okay, so these are simple shapes and these are complex shapes. All right. Okay. All right. So these are just few points for like your assessment of the fine motor. Please do remember when we talk about the fine motor or developmental age of the child, do remember that is very important point. If the child age is less than 2 years, if the developmental age that is less than 2 years, you will describe. You have to make a difference of the 3 months between the child age. Like the child age is between 15 months to 18 months. But if the developmental age that is more than 2 years, then the child age may be, there is the difference between the developmental age, like that is plus minus 6. Okay. We will say the child age is 2.5 years. But if the child developmental age that is less than 2 years, make a difference of plus minus 3. The age of my patient is 15 to 18 months. Okay? All right. So this was all about today's short class for the fine motor assessment.